Hello, everyone. This is Dr. Hockman here. I am a family medicine physician and the CEO and founder of Happy Day Health, where I help physician owned practices to find physicians to join their team. And it's all based on physician autonomy, helping doctors really find their autonomy in medicine. And that is what I love doing here with these interviews is showing doctors some interesting ways of finding their autonomy, finding work-life balance, and really empowering us as physicians to take control of our lives. So today I have Donna Corriel. She is the founder of SoMeDocs. So Donna, thank you for joining us today. Tell us
Thank
a
you
little
so
bit
much.
about you and SoMeDocs.
Sorry, I jumped the gun there. Thank you so much for having me on. I'm always excited to do podcasts and live streams. So I'm Donna Corriel. I'm an internist. I trained traditionally, and I am now a full-time digital entrepreneur. And I have not left healthcare, although I have left clinical medicine. I now practice regularly in a different setting in the hopes of promoting autonomy for doctors everywhere through all kinds of digital tools that are both existing and ones that I build using the skills that I discovered I had over the last few years.
That's great. I love that you're staying in the medical sphere and really fighting the good fight with us.
Yeah. And that's an important point because I think that, doctors sometimes leave medicine for a variety of reasons and to each their own. But recently there was, a little bit of a tiff between about that topic, I'll just say, where it was said that if I leave medicine, that I should no longer have a say in how healthcare is run and just healthcare in general. And I think that could not be further from the truth. I think that if anyone is going to advocate for change and speak up, it's somebody that has been in a system that they deem, abusive or whatever adjective they use, and are putting their skills and their talents and their experience and their time towards bringing about change. So I don't think that we should discount anybody, regardless of if they're still practicing or not.
Yeah, and that's something that I hear from a lot of entrepreneurs, and I've had myself too. And I think this kind of speaks to the social media side of things. I think it's hard for anyone when you haven't been in a certain situation to really understand it. And any physician entrepreneur that I know has had some sort of backlash of, I mean, we've all heard things that are really hurtful, like, oh, you're just trying to make money off of us, you're just using us. And I think at the beginning, I thought my skin will never be thick enough because that is so hurtful. Um, but it's thick enough now. And, I think once you've been in it a while and you're like, well, I'm here to help people. And that's what I do.
I think that the healthcare field in particular has some interesting ways of pushing certain personalities up to a corner, I'll just put it lightly, and making certain humans feel guilty if they think a certain way. And it really takes advantage of our kindness and our gullibility and our innocence. A lot of doctors go into this with compassion and with good intentions. And the medical path almost like beats out of us any notion of looking out for ourselves or making sure that we are okay, to the point where we are not only sacrificing, but sometimes sacrificing to our detriment. And that's not where we should be. It's almost taken to the extreme. And I think that, like, as a profession, we need to take it back a few notches and kind of reconsider what we're doing to doctors in our profession nowadays, with burnout being as high as it is, and how we can scale it back to a point where the doctors are back to being happy and being healthy enough to give themselves to the patients that they are treating.
Yeah, that's very interesting. I think a lot of the things you said have a lot of parallels to, children in families where there's been some sort of physical or emotional abuse. And I think that speaks a lot to the environments that we were raised in, from little baby doctors to attendings. We were kind of raised in those environments. And I have to say, I've been very fortunate. I had the best residency with supportive attendings and supportive, my co-residents were great friends. but I know that was not the experience with a lot of physicians. And maybe it's shaped who I am, and maybe that's the reason why I had the courage to go out and start my own business, because I didn't have that beaten out of me quite so much, maybe.
Yeah, maybe. I mean,
I
our
don't know.
experiences shape us. I mean, just now, I love that this is a live show, and I can say that just now I posted on my feed, I shared a post about um something. I'm just thinking about the context, the specifics of it. I shared a post about, oh, you know what it was? It was about um paperwork from a doctor's office being too much. And I sort of extrapolated from that and talked about the burdens of legalities in the medical field. And it got an interesting response from someone. And I just spoke about having to like cover your ass like too much, excuse me for my French. And forcing doctors sometimes to have to write these like novels in their consult notes or in their paperwork. And I got somebody to respond to me right away. I think that she was a little bit angry because she must have had like a case of malpractice on herself as a patient, that she felt very strongly about and was very angry at how it was handled by the doctor or whatever it was. And it really stresses the importance of our experience, our personal experience. We bring to the table our own experience, and that often shapes our opinions and our biases. But I think that in discussing matters, especially matters that don't work, I think that you have to kind of explore all sides to make it work, right? I mean, when we talk about like why we generate so many papers in the paperwork of a visit, there has to probably be reasons why those were implemented in before we, vent about why there's so many papers and it's just too much. So yeah, it's very interesting to kind of think about those perspectives and to, take it back to the example that you were talking about like an abusive relationship. To some degree, it is sort of, again, I'm not, because I'm not thankful. I am so thankful to everybody that trained me as a physician. It makes me who I am today. But there's something about our profession that's abusive, just in the way of like, again, taking away from us the ability to say, I am human too, and I should matter. It's almost like our profession says, you don't matter, and you should put yourself last after the patient, and nowadays after the healthcare system.
No, that's so true. Well, let's talk a little bit about social media because you're SoMeDocs. Um, how do you feel like social media can really benefit a practice?
Social media can benefit a practice itself in so many ways because it's free marketing. So I look at it as highways. I lecture on this a lot in conferences and such. They're highways, and social media are like the billboards, and we put ourselves in those billboards for free. The question, of course, is just how we get the best located billboards so that there's a lot of traffic that sees us, and how we craft our messaging so that our calls to action are actually effective. And that involves a lot of active thought into what our call should action to be and where interested parties interests should land. Everybody should have a website, but more so, it's more than practices that should have presence. It's the physician, him or herself. And the reason I say that is because you own your practice. So when you say, how should our practices, you're asking for yourself, because your practice represents you. But there are plenty of doctors that are listening to this that don't own their practices, or are merely an employee of their system. I had Dr. Alejandro Badia on a recent show that I created. I create a series. Dr. Hockman's going to be a guest soon. And he was talking about that, right? Yeah. So he was talking about that. And he was talking about like individually taking on the practice and the importance of recognizing that you don't necessarily have to work for an employer coming out. Although he did quote, I don't know, he said that it was something like 80% nowadays of residents that are coming out of training are working for, are employed, as opposed to like in the 90s or 80s. I don't remember exactly how old he is when he was graduating, and it was like in the single digits So again, I think that how we see ourselves in the landscape of social media is important. If we own our practice, then it's marketing our practice. If we are employed, then it's about taking the individual and it's about marketing the individual, learning how to brand ourselves so that it represents ourselves and ourselves only. While we work for the employer, it can also represent them. We have to, of course, be respectful to the employer that is employing us. But at the end of the day, we have to be true to ourselves, because when that system will either fire you or you leave that system, all of your intellectual property, meaning all of the content that you have created until then, can then move with you to the new system that you're going to work in or to the private practice that you're going to work in. So again, essentially it's marketing is all it is, but you've really, as a doctor, you've really got to understand that you can and should market yourself as an individual nowadays, so that there's less control of who you are and there's more autonomy and there's more of it's just me representing myself here, and I just happen to be working for this particular company today and can easily be working for company B tomorrow and take all of what I'm about there.
And there's so many benefits to that. Part of it is that you're more valuable to the employer because they know that you have that presence and the following. But also, when you leave, or if you leave, when your patients know where to find you, because you're not going to be able to say to them, "Hey, come follow me to practice XYZ." But if they follow you, you can say, "Hey, follow me on social media." Easy peasy, right? You're not
So
telling them to follow you.
yeah, I actually went over that with Dr. Uday Khosla about that. The fact that they essentially own you at many large systems when you don't have presence. When I left a big system, the patients aren't told, and they're not told on purpose because the system wants to keep those patients. They don't want those patients following you. And
Right.
it's a setup, because the patients end up getting upset at the doctor because they think that the doctor didn't tell them. And a lot of times the doctor isn't even allowed to tell them because it's part of the contract. And it really looks like the patient is abandoning them, when in reality, there's nothing more than the doctor wants than to have patients follow them. And that continuity of care is so important to us. We're not escaping, we're leaving probably for a good reason, whether we're fired or we chose to leave. And we would love for our patients to follow, but the healthcare system is a business, and a smart business at that, and they don't want the patients leaving. And if we are present on social media and we actually build a brand, then we become valuable individually. And then there's a lot more worth to us than just the system sitting there and having like the same patients come no matter what cog fits that wheel, right? That cog now becomes more than a cog. It becomes a gold cog that's worth something. And when that cog is replaced somewhere else, the patients go from point A to point B, and they follow that doctor. It becomes, you're no longer a cog, you're actually the human that made the connection with that patient, and that patient can now find and follow. So, and there's a lot more to social media than even just that, but that's like at the basics of it, right? Is build presence so that people can essentially be your fans. It's almost like celebrities, and it is celebrities. I mean, we're celebrities of healthcare, and patients can become our fans, and they can move with us to whatever movie we're starring in next, right? I mean, I hate to say it like that, but it's true. And at the end of the day, right, it's about them, it's about treating them. But if they want to move to follow the doctor that they love so much because they formed a bond and that doctor knows them for so many years and they feel heard and seen, they don't want to just be seeing a new cog. They want that
Mhm.
doctor. And
And the
again,
doctor wants the patient too.
100%.
Yeah.
And the way it's set up, it almost is like the patients get mad at the doctor. And again, I've experienced it firsthand where the patients ultimately, for example, find me and almost like they're angry, like in a relationship, they would be angry, or and kind of spend the first few minutes of the visit almost like upset with me and letting me know how angry they were that I left them. And the answer is, but I didn't. I was not allowed to say that I was leaving, nor to tell you where, et cetera, et cetera. I mean, the big hospital system is not going to send them, a little note saying, if you want to follow the doctor that just left us, go ahead,
Right.
here's their address. They're definitely smart and they're not going to do that. So you've got to make sure that you do that in some way. And that's, again, building presence. It's collecting emails from the patients that really love you as the celebrity, right? I call it a celebrity, but we both know what I mean. I mean, it's not from a narcissistic or an arrogant way. It's in a way of entrepreneurially looking at this and understanding that it's the doctor that should be followed if the system makes them leave, versus, right, having to stay in the system and then not letting our patients know where that doctor that they've connected for so long with, where they are.
So we had an interesting question that Chris Brown asked. He asked, "What about HIPAA issues?" So when it comes to patient, we're very aware of our confidentiality and all of that. So how does this really play into HIPAA and confidentiality?
Well, I mean, HIPAA is about, not sharing our patient personal information. To form presence for yourself on social media is about you. It's about the patient following you. Really, there's no HIPAA violations there. And again, if the person who asked that could be a little bit more specific about what he means by HIPAA issues in this particular context, I can better, explain it, because to me, HIPAA is about the information that's shared during a patient visit, right? I'm a doctor, a patient comes into my office and shares with me that something very personal that they do not want the world to know about. That information should not be shared. That's, if what he means is that, how do we, share our patient's information? That's not what I am suggesting that doctors do, is to go online and to share patient information. It's to share the doctor's information. It's to say, hey, I'm Dr. Corriel. My website is at drcorriel.com or doctorsonsocialmedia.com. You can find me there. You can book me there. And you know what? I will be writing a blog there as well to write to you about my expertise. If I'm a hypertension specialist, then I'm going to be writing all kinds of blog posts about high blood pressure and maybe some of the treatments. And I'm going to, and you know what? I'm going to create a course on hypertension, and I'm going to create resources. I'm going to be a speaker at SoMeDocs' conference about hypertension. And the point is that you're not sharing anybody's personal information. That doesn't mean, by the way, that you can't, talk to a patient, for example, who wants to help you to get the word out and says, you know what, I will sign right here and allow myself to be on camera with you, just kind of talking to you maybe about hypertension and about how this has helped me as an example, or blah, blah, blah. Like, there's a lot of ways that we can abuse the system, and there's a lot of ways to do it the right way. As long as you're respectful of your patients, as long as you're not sharing any secret information and harming anybody, there's so much good that can happen when using the online world.
So, okay. So Chris Brown says, I am a hypertension specialist.
Well,
He
oh,
says,
that's so funny. What a random thing to.
he says, if a patient is following me and the patient mentions a condition, would that be an issue? Or if they reveal their information, do they waive HIPAA?
Yeah.
So, sorry, I'll let you take that one.
No, that's such a good question. That's such a good question. Because HIPAA, HIPAA is great, first of all, because HIPAA was created to protect our patients. You and I are doctors, but you and I will also be patients, if not are not already patients. And it is important for me to keep some things to myself, just like patients would. It's our privacy. We don't want our doctors going on social media and spouting off, my whatever it is, right? Like my chlamydia. I don't want people to know, if I had chlamydia, then I would be horrified if my doctor was like, that last patient had chlamydia. I mean, it's so private. It's so private, our lives. And when we go in to see our doctors, it's such an intimate relationship where we really should feel trusting. So it's really important for a doctor when they establish an online presence to make sure that they adhere to this, that they make their patients feel loved and protected and safe while still going online and sharing more about the doctor and less about the patient. It is a problem when you have online presence and your patient decides to come on and sort of share something of theirs. Now, I am not a lawyer. I'm not a lawyer, so I cannot pretend to say whether at that point it's okay or not. I would assume, again, I'm assuming here, I'm assuming that once they reveal that they're your patient, you can kind of take their lead and rally with them from that. But you still can't like expose something that they have said during a visit just because they have decided to share that they are your patient, right? So taking that chlamydia, I mean, I hate to use that example, but it's an example of something that someone would feel is private. But if a patient like had chlamydia and was treated and you post about hypertension and they kind of comment to you about like hypertension or about being your patient, you can't go in there and mention something about their chlamydia. You see, that would be a HIPAA violation in that sense. But if you're going in there and you're just answering their question about hypertension, again, not about their medical condition, I would suggest against that always, but write about hypertension, maybe about you're talking about hydrochlorothiazide, right? One of our medication for hypertension, then that's kosher. That's legit. Again, not a lawyer, can't promise, but I do think we are shaping this field as more and more doctors come on board.
Mhm. And I wanna, just kind of say that it's not that they're waiving HIPAA. It's more so that they're saying, "Hey, if I have hypertension," and typically what I do in those situations, if I were to post publicly or even, if a patient were to message me privately, which if any of my patients are watching, please don't do that. But when they do, I may just say like, "Hey, I'm not this person's doctor. This is not medical advice. If I were to see someone, what I may tell them is this, but I don't know the situation. I am not your doctor. Even if I am your doctor, this is not my situation. Like my lawyer tells me to say this, please no, all those things. So, I think that's an important topic to know about. Someone else had an interesting question is whether it would trigger the Stark's law, which is the anti-kickback law, if we tell patients where to find us.
That's a great question. And again, I'm not a lawyer. Um, I don't see how that's a kickback situation. A kickback situation is where you're getting money for referring someone to someone else. Again, not a lawyer here, but totally different than just saying to someone, "Hey, I am moving practices and here I am." Now, what can limit your ability to say that is if the healthcare systems are being clever and strategic entrepreneurially, and they are inserting verbiage into their contracts that's saying you cannot tell patients where you are going. So again, I don't see how, this would pertain to kickback laws because you're not really kicking back to anyone. It's yourself. You're just telling someone, come to see me here. So yeah, that's my answer. Although again, I'm not a lawyer and you should absolutely consult with a lawyer. Again, this brings back, like, think about these questions that are being asked. They're so good, but they highlight just how bound we are, right? As autonomous individuals. And it highlights how harmful this can be for the patient because the only person that's benefiting here is the big health system, right? By binding us to be able to being able to, by not being able to tell patients where we will be practicing tomorrow, we're preventing continuity of care. It is harming health. That's what it's harming. And if it were to actually happen, what would it harm? It wouldn't harm health. It would harm the pockets of the healthcare system. And again, entrepreneurship is important. It's what this country is built on, right? We're in a capitalistic society. But at the end of the day, you can't have monopolies making these decisions for us. And especially when the ultimate endpoint result is harming health. That's actually the endpoint of that equation. It may seem like it's the doctor being all like arrogant and saying, well, I need it. Like I need to be in control. Yeah, I need to be in control of the health relationship. At the end of the day, it's me and it's the patient. That's who should be in control. All those middles that have inserted themselves, they might have been inserted for a reason, right? To ensure that there's no greed, to ensure that there's some regulation. Fine. But it has gone to the point where we have gone from this, the doctor and the patient, to this. And I can't get my fingers to stretch out far enough to show you that there's so many middles that it's like it's actually harming our health.
And this goes back to what we were talking about at the beginning of this discussion. And I have an ask for everyone watching who is a physician. Please put down here how much you would love your patients to follow you and how the hospital systems really control a lot of what we do. And the reason why I ask you this is because for anyone that may see this that isn't a physician, I want them to know that it's not us as physicians who are, all the things that people get mad at us for, which is charging a copay at a well visit if you've discussed any med refills or any of those things. It's completely out of our hands. And, it's kind of a hurt the messenger. What's it? Kill the messenger
Yeah.
situation. And so, anyway, that brings back to what we were saying at the very beginning of if you don't understand the situation, if you don't understand the full breadth of what's going on, it's hard to understand a person's perspective. So, just as physicians, we get frustrated that patients get mad at us because they have to wait. Well, we know that it's because we don't get enough time with the patients. We have, to do X amount of things in X amount of time. We get upset that patients are mad at us for billing during well visits, but they don't understand, like, if we didn't, that would be fraud. So I think, if anyone watching takes anything away from this, anytime you get mad at someone, just think, what else, what am I missing here? There's probably something going on that I'm not understanding.
The healthcare system has done such a great, I'm putting it in quotes, a great job of vilifying the physicians, because by vilifying the physicians, they can tighten the control. And what they do is that they build a narrative where they care about the patients so much. And it's the doctor that's the dispensable part of the cog, right? So, for example, this has been the reason why we're, for example, being replaced, right? The healthcare systems a lot of times are saying, well, now we're going to replace the doctor with someone with, let's say, a different degree, but they care more about you. No, they don't care more about you. They care just as much. I'm not saying they care less about you, right? They're still human and I still respect other degrees. They don't care more about you. They just have different terms.
Yeah,
right?
as one person just commented, that's why software engineers are contributing more to the healthscape than us as physicians.
Exactly.
Exactly.
It's it's about churning out a machine. It's about churning out a product. It's about how do we make the cogs work faster, the cogs being us. And then it's about ultimately, how do we make those end products, AKA the patient health, seem like it's because of the cogs that the health is compromised versus the doctors, versus the fault of the healthcare systems who sit at the top with the joysticks. I've written an article saying that it's the joysticks that are controlling this that are responsible for it.
And that's why we need a social media presence so that we are in control of being able to tell patients. And we don't have to say, hey, all my patients, where are you? Please come follow me. But you can say, I am now moving to XYZ. I would love people to come see me there. Done. And then your patients know where to follow you. I think many of us as physicians have been in that situation where we left a practice and we were inundated with our patients trying to find us on social media and, somehow finding our email addresses and trying to find us. Whereas if they just followed us on social media, easy. So having that social media presence is so important. Hence why SoMeDocs is so helpful.
Totally. And you know what? Like, it's so much more than just having patients follow you. We just kind of hit the tip of that iceberg.
Oh, yeah.
It's about a new medium. I'm thinking of how to word this. It's like a new medium with which we really can amplify why we actually are experts. Like, here I am, right? Donna Corriel. Let me give me as an example. I was working in a small practice. Nobody knew my name. And again, that's totally fine. If I'm perfectly happy working in an environment that I feel good in and I'm not burning out in, then that's totally fine. I'm working as a physician. I'm healing patients. Maybe my, example works. Maybe it's a private practice where I get to set all my rules, right? But once you allow yourself to go online and actually market your thought leadership and grow it and get your ideas out there and show people that you're skilled in a particular subset of skills, you can have so many opportunities come your way, right? I mean, I've built a company. My company is SoMeDocs, and I'm now building conferences, right? Virtual conferences, which, and you're a chair of one of them, but we're paying speakers. Like, how am I finding those speakers, right? How are those speakers getting to be a part of our incredible project? How are they getting all the exposure that we're giving to them and getting to play a leadership role in our live event? Most of them have had online presence. We have found them because they have built such a great presence online and have become the experts that we are looking for. That would not have happened if I was still practicing in my, little, office. Again, there's nothing wrong with that, but for me to have identified those speakers now, they were identified because they have online presence and because they did a good job doing it. Anybody can do that. Any doctor can do that. And your endpoint goal doesn't have to be being a speaker at a conference. It could be starting your own private practice and just getting more visibility within your community. So, for example, your community recognizes that they will get more time with you than if you were working in the local health center that basically employs the cogs, right? And maybe again, there's so many potentials. I don't want to go through the different scenarios, but the point is that you build up your autonomous individual worth, and you're worth more even to the health systems, by the way, because negotiating with you, if you come to the health system and you're just like a regular doctor, which is amazing in and of itself, but you're a doctor with expertise, great. They can market you. But if you come already with marketability, if you come with 1 million followers that are already following you online, the health system benefits. And you're in control of that negotiation, okay? Because you're now coming with 1 million followers. And so guess what the healthcare system is getting? It's getting the notoriety that you're getting, and it's getting a line out the door for you to be seen in your clinic. That's going to mean a higher salary for you and more respect. They are going to be much less likely to want to fire you and get rid of you, and much more likely to work with you on your demands.
Absolutely. I want to go over one question that we had from someone watching, and then we'll switch gears a little bit to the conferences. Maybe we'll talk about our conference. Here's the question. Other than using social media, how else may I market my consultation and acupuncture services?
There's a lot of ways to market it. So first of all, I got to say it because I'm the creator of SoMeDocs, and not doing it would be a disservice to me and my full time.
And yourself.
Yeah, exactly. You become a member of SoMeDocs, which is free to any doctor, medical doctor that practices in the US, has an NPI number, and within 30 days of approval submits a profile form. It's a no-brainer to come on for free because you get to be part of a directory that's public and free to use. So it's actually free on both sides, and it democratizes that system so that you can come on for free and the person using it can come on for free. So, it's being used by media, by journalists, by startups that are looking for advisors and such, by podcasters, by events looking for speakers, by patients, by other doctors. I would absolutely do that first and foremost. If you're the public and you're using our directory, you can use our geographical filter, but you could use other filters that are really unique. So I would absolutely encourage you to come into our directory. And again, the really cool part of what I've built is that it really highlights you for your degree. So anybody that lands on our website knows that they're getting a verified doctor with the degree listed there. In the doctor directory, you're getting a medical doctor. Again, whether or not we're going to build other directories, for example, PhDs have shown interest. I may build like a separate directory that gives them the credit because they're doctors. They're just not medical doctors, but should still, get the credit for being a doctor. So you can absolutely and should do that. Other ways to market your acupuncture and consultation services could be, first of all, building a website. I mean, that's actually the first step. When I talk at a conference, That's the first step I always say is important, is to build your own space. Social media at the end of the day is not owned by you. So you're not, if it goes away tomorrow, then all the work you've put into that social media platform, it goes away, right? You may have built up your fans there, but those fans go away too. So a website is a great way to capture the interest of anybody that could potentially be interested in your services, right? It's almost like your leads, and then you convert them at the level of the website. So it's absolutely crucial to market by first building an online space. And that's, your prime real estate property, online property is your website. And then building social media presence to kind of bring interested parties to your website and to sign up there.
Do you have a virtual conference on that, on building your
Yeah,
brand?
so great question. So yes, it's not scheduled yet, but I am creating a conference for social media marketing and networking for healthcare professionals. And the crux of it will be this: it will be branding. It will be, where does my website fit in versus how do I use social media platforms? I do have for SoMeDocs, for people that choose the higher levels of SoMeDocs, there's the free profile level, highly recommended. But then there's a beyond level and a network level. The network level gets some of my lectures, access to those lectures where I lecture about how to use some of the social media platforms of today. I highly recommend that. But again, you also can get, a consultation hour, an incubator hour, excuse me, once every 3 months, along with networking. And again, I'm building more resources where I can bring doctors together and really teach them these concepts, along with networking, because to me, networking is actually everything nowadays.
So we'll post as soon as we are done with this live stream. What we'll do is we'll post the website for any physician to go sign up for a profile if that's something that you're interested in.
Yeah.
All right, one more question, then we'll go to the conferences. What is incubator hour?
So incubator is, for at SoMeDocs, in this community of doctors, a lot of them are extremely like entrepreneurially minded. And by that, I don't mean that they want to build a product. They understand that to build autonomy for their practice or for their future practice, they need to join a like-minded clan. So we join, right? But we need a way to connect. So what we do is every 3 months, we get together for a virtual networking hour. And then it's followed by an incubator hour where, and maybe the words I'm using is wrong. I've been playing around with the words, but I think I still call it incubator, where you're asking questions, getting answers, and now it's more personal. So you can actually ask questions of me and I can explain to you based on who you are. And then we're also getting feedback for some of our work. I mean, we have so many other features, like we have pods where we get together with a smaller amount of docs and we share our work with each other so that we can come together during this every 3 month incubator hour and sort of share our work and ask everybody, well, what do you think? How can I make this better? So that's what an incubator hour is.
That's great. Okay, let's talk about our conferences. So you and I are putting together a conference on Private Practice 101, which is really cool, actually. I was speaking with a doc this morning who we were talking about a job that he applied for, one of the jobs that I'm working with, but ended up not being the right fit for various reasons. But at the end of speaking to him, I was like, well, why don't you open your own private practice? And he's like, oh, that would be my dream. But it's too daunting. I was like, well, sign up for my conference. It's free.
Yeah.
So let's talk a little bit about that. So you have conferences through SoMeDocs, and the one that we're putting together is Private Practice 101, and it's really the nitty gritty of starting a private practice. And we go over a little bit. We go over, a little bit about everything. We talk about different types of private practice. We talk about some legal things you need to know. We talk about getting your personal finances in order to be able to do this. We talk about the finances of your business. I mean, we really are covering everything. So I think I took the thunder here. Tell us about the conference.
No, you didn't. I love it because Dr. Hochman's a chair. So, in building out SoMeDocs, I decided that there needed to be more resources provided to doctors everywhere, and they needed to be created with less barriers to entry. And to me, a lot of the conferences nowadays that happen, they happen in real time. So they happen, I'm sorry, in person. That's a lot for people to do, like to leave your family, to have to pay for tickets, and they're very costly. And again, not to put down in-person conferences, because they're actually great and you can't do everything in the same way virtually, but you can do a lot virtually. I decided to build virtual ways to connect more and to learn more and to do it more rapidly. So and again, I can do that because of these newfound skills of digital creation. I create very fast. I really outsource very little, and I can make it of great quality. So I decided to build various conferences, and one of them is a private practice conferences, because it's a no-brainer to me that every physician out there should at least consider what goes into the possibility of building autonomy through a private practice. I was going to do it, and I was overwhelmed when I stepped away from my clinical practice. And again, if SoMeDocs hadn't taken off, I probably would have been building something of my own, just given the skills that I had built. But I partnered with Laura, and we said, let's build something that's really of value. It's very important for me to limit the fluff that's out there and really just bring on speakers, pay the speakers, right? So make it enticing for people to come in. And again, originally, we priced it very no-brainer initially. We priced it at $249 to access this live free event as it was taking place in real time. So speakers are taking their time, they're speaking live, they're lecturing, full lecture, I mean, with slides and everything. But Laura and I decided to do even better. And yes, it's a sacrifice on our part, because what we have to do is now, pay speakers and pay marketing and all those things, but make it free. And we decided that it was more important to get even more people coming and have it be free while it's live, so that the doctors that maybe either can't afford it or just don't really feel like spending the money, they can still get this really important information and get it for free while it's live, and really benefit from it. And hopefully, become autonomous or take the first steps to becoming autonomous. So that's what we created. Now it's basically called Private Practice 101. It's for beginners, and we are
beginners in the private practice space.
What?
I'm not saying residents only, but beginners as in
Yes.
beginners to private practice.
Thank you. It's open to anybody. I mean, the general public can sign up too, because it's free.
That's true.
Yeah, anybody can sign up that's interested in private practice, or even just interested in like a lecture in it. You can, look at the landing page. It's filled with the details. Every single speaker has submitted a promo, almost submitted a promo. There will soon be a preview so that you can actually get a taste of what these speakers are like. And again, the best part is that it's free while it's live. Now, if you do want to purchase access to the lectures after, you can, and that's like a VIP option that you can do ahead of time for $149. You can have access to all of this for 6 months out. And again, that price is a no-brainer and is a steal, because you're getting all of this stuff and you can actually watch it at your own pace. So I invite everybody to, at the least, sign up for free to watch the incredible speaker lineup. And don't take my word for it. You can go to the landing page and you can see like that we're serious. We're getting an amazing speaker lineup to talk, and you can sign up and free up those days and come and join the discussion.
Well, it's going to be fun. I'm excited. I'm excited to just spend time with a bunch of doctors. I love that. And
Totally.
hopefully inspire and answer good questions. Someone asked, Sarah Nesser asked, can we get CMEs for the conference? The answer is yes. There may be some changes coming through CME-FI that may change that, but until that time, yes, they are. And how many CME hours do we get for this one? Do you know offhand?
I believe so. Again, we work with, I'm full transparency. We work with CME-FI. It was 1 CME credit per lecture. The problem right now is that CMFI is changing their rules as of May 15th, and I am not sure I understand those changes. That's who we've been working for years. And so this change is kind of coming on abruptly. And so I'm not really sure what that means. Either way, if there will be CME credits that are attached to this, then it will be attached to the paid portion, meaning the VIP ticket will get you those CMEs. Again, just because there's kind of more work that goes into putting CMEs together. So yes, we're hoping that there will be CMEs. They will be part of the VIP option. And again, if you don't need the CMEs and don't need that prolonged access, you can join us and not pay a dime and just kind of come and watch live.
Please do come. I would love to see you all
Right.
there.
Absolutely.
Yeah, and I really do think that part of us getting our voice back in medicine is being in leadership and being the more of us that are not the cog in the wheel. I think the more impact we can have on everything to do with medicine and our autonomy and
Yeah,
everything.
and building resources that connect us in ways where we can discuss this more openly. So I invite also everybody to kind of listen to or watch the new series that I have going, which is called Entrepreneurship with Dr. Corriel. Sorry, Entrepreneurs in Healthcare with Dr. Corriel, where I bring a guest on and I discuss the truths of entrepreneurship. Again, going back to the beginning of this live hour when I was talking about being told that I don't belong because I left clinical medicine, it really irked me. Like it really got to me. And that really pushed me to create this particular show. I run many shows, but this particular show is really important to me because I think an entrepreneurial mindset is so important in conquering our autonomy and to taking back medicine the way that it should be taken back.
Yeah, and it's really a very different mindset. I'm paid salaried, and I had a patient no show yesterday. What day are we today? Tuesday? Yesterday. Is today Tuesday?
Yeah.
My days are backwards. Um, and I thought, oh, I really needed that break. Thank
Yeah.
goodness I don't run my own practice. So, because it's a very different mindset.
Yes.
So, you know, just a thought there.
Right.
Well, thank you for coming. As everyone watching can tell, Dr. Corriel has a lot of things going on with SoMeDocs. So we are going to paste the link to sign up for a free profile on SoMeDocs, and we'll also paste the link to the Private Practice 101 conference. Both are free, so please do come to the Private Practice conference, even if you're just curious about what private practice is all about. You don't need to be a new resident. You don't need to be a seasoned attending. You can be any kind of physician as long as, well, I guess you don't even have to be a physician, but you'll benefit if you're a physician.
Yeah.
So join if you want to learn about private practice. Join if you're thinking about starting a private practice. Join if you would love it, but you're daunted by the task. If you're just like, what is that all about? Come join us. If you are happy being a cog in the wheel, maybe this conference isn't for you. But if you'd like your autonomy, if you'd like to know what is out there and if the grass really is greener, please do come check it out. And you can find Dr. Corriel on doctorsonsocialmedia.com.
Yes. Doctorsonsocialmedia.com and drcorriel.com. And someone's asking where the link is. So when you go to doctorsonsocialmedia.com, you basically click into the resources and there's a learn section. There's a content section, a directories section, and a learn section. In the learn section, there's conferences. And when you click it, you can find all of the conferences that we already have scheduled out.
And we'll go ahead and paste that below in
Awesome.
the chat as soon as we hang up.
Wonderful.
So that's Dr. Corriel. I'm Dr. Hochman, Laura Hochman, the medical matchmaker. And if you're a private practice looking for a doctor, let me know. I'd love to help you out. And if you're a physician looking, check out my website. I have some awesome positions. They all treat their doctors like gold. So thank you for watching. And we'll go ahead and paste those. Bye.
Thank you for tuning in. Bye, guys.